My first tip for somebody who is new to the chronically ill community is don't be afraid to get a second opinion. If something doesn't feel right or you're unsure, ask questions. Don't be afraid to do that. It's very important.
The second tip that I have for someone who's newly diagnosed with a chronic illness or has been living with a chronic illness is get records of your own tests. You can get them to put CC patient, so you have your own copy of your own blood work, because then you can take them if you have new specialists and they haven't transitioned all your information. You can have a file that has your information, and it just makes you see more together, and you feel like you're more a part of your own treatment if you have more knowledge of your treatment. That being said, sometimes results will be abnormal, but they'll be normal for you. So the opposite flip side of that is if you don't know how to per se read them, then make sure when you go into your doctors that they're explaining it to you so that you're not freaking out because something's out of normal range, but it could be in normal range for you.
My third suggestion would be that when you are diagnosed, which will usually be done through your GP, is don't settle with just having a GP. You will require to have a medical team who is looking after you, which will be a variety of specialists to treat different aspects of your illness. So for instance, a rheumatologist, a neurologist, an endocrinologist. You could have a massage therapist as part of your medical team, or a chiropractor as part of your medical team. But you need to have different specialists dealing with the different aspects of your illness, which also prevents your GP, who may be wonderful or may not be wonderful, from getting overloaded with your disease or medical condition.
The fourth tip for someone who's newly diagnosed with chronic illness is get involved in community efforts, whether you can get involved in something within your own community or online. There's some great websites out there. One of them is www.butyoudon'tlooksick.com. Another one that's for women with chronic pain is forgrace.org. And Rest Ministries also has some great programs. Restministries.com, I believe, is the website. And there's lots of chronic pain groups within communities. There's a group through Rest Ministries called Hope Keepers, and they're a great group to get affiliated with as well. Just get out, meet some people maybe with similar conditions, so that you can share thoughts, and maybe if there's alternative treatments that work for you, you can share them with people with similar situations.
My fifth tip is for people to not be afraid to use mobility aids, regardless of your age or anything like that. It's an excellent thing to do is to have an occupational therapist come into your home or to your work, and what they do is they assess the environment that you're in and give you suggestions on how you can improve your mobility around your home or at work, and ideas of things that you can get to help you around your house. For instance, I use a cane. I have a chair set up in my shower so that I don't have to stand to have a shower if I'm having a really bad day. You can get bars put in throughout your house. There's all different kinds of aids that you can have, and don't be afraid to use them. So don't be ashamed or embarrassed to use your mobility aids. If they provide relief, if they provide, an environment that makes your life simpler, then don't worry about what other people think or say. because if it's helping you, then that's the most important thing. You being comfortable and able to be mobile is the most important thing, not what other people think.
Okay, I'm tired. Basically, this little tip is about people in your life who aren't sick, who just really want to help. So they tell you to stand on your head or roll your tongue or take these vitamins and you'll be cured. Try this method. And I'm not saying that there are a lot of really good alternate therapies that can help, but just it's okay to be frustrated with people that are telling you crazy things. I once had someone tell me to eat more cayenne peppers and I'd be cured. And it's okay to feel frustrated with people, but just try and remember that they're coming from a place of that they want to help and don't know how, maybe. And you're gonna get some people that are just know-it-alls and who are just going to say, do this, So just try and take things sometimes with a grain of salt. Sometimes you'll need a whole truckload, depending on what it is. Just try and remember that it comes from a place of love, usually, and that it comes from a place of someone's helpless and they want to help. They know sometimes when you have a chronic illness, you feel helpless too because you're not in control like you maybe used to be if you have a chronic illness that you didn't have from birth. So.